Hi everyone, I'm Sashikanta Prusty, certified prosthetist and orthotist with Robotic Rehabilitation Center. So today we have a topic related to below knee amputation and below knee prosthesis. Related to that, we'll be having a small discussion about. So what do you mean by a below knee amputation? So below knee amputation basically when surgery happens down the length of the below the knee, where the bone is cut down in between from tibia and fibula. There will be a described length, and then once the stump is ready, we will be planning for a prosthesis. Basically, when we talk about amputation, it will be disruption to the continuation of the lower extremity below the knee, and there are various reasons behind below knee amputation. Let it be like now very commonly we can say is because of road traffic accident, or because of some disease, because of some specific conditions of vascular problem, where that leads to have deficit of blood supply to the below the knee, the part leg, foot, or some part of it. The surgeon, they go for a decision to go for an amputation. So after the amputation, when we talk about below knee prosthesis, is very important to make yourself ready for the prosthesis. So to make yourself ready for the prosthesis is important. Like first is the stump health. So when we talk about stump health, we have to see how we are going to make the stump ready for the prosthesis. So when we see about stump, first initially when the surgery happens, first thing we have to look into is that the stitches are removed properly, swelling is controlled properly, then there will be proper sensation. If the patient is having some phantom pain, phantom limb sensation, or some kind of irritation, or there is a joint range of motion also we have to look into. So specifically after the surgery, we normally see 6 to 8 weeks is a normal time to understand the stump is all set, healthy. Then suppose in case we find the stump is not ready, or there are specific conditions in the stump, then we need to talk to the surgeon, and we need to understand what is the problem is because of, or any specific scar mark which is very sensitive. So we have to go for some therapy sessions, or phantom limb pain, then we have to go some specific therapy sessions for the phantom sensation to be removed. And then strengthening exercises also is very important, because some moment when the continuation of the muscle is disrupted, so definitely there will be weakness to the muscle, or there will be some amount of contraction to the proximal joint, that is to the knee joint. So we have to check that if at all there is any specific contracture or any specific conditions where probably that problem is going to disrupt the fitment of below knee prosthesis. So we have to first address everything. Once the stump is all set, already skin and all wound is closed properly, then we have to plan for the prosthesis.